Hi, I'm Travis. I'm going to be a level 1 student nurse. Is it okay if I follow you?
Sure, go ahead.
Alright. Can I get a quick SPAR report on your patient?
Yes, today we are receiving Levi Restivo. He's around 6'20". He's a 67-year-old male. He's a full code. He came in, he has a stage 2 diabetic ulcer on his right heel. He does have type 2 diabetes. He came in with an increased blood glucose levels for the past 5 days, all within the 300s. He did notice the ulcer on his right heel about 3 weeks ago. It has not healed since. Um, he does take insulin. He is insulin dependent, and his normal blood glucose is in the 120s. He did come in 3 months ago, and he had an A1C test, and that did come back at 8.2%, which is a little high. So today we are going to go ahead and give him some medications today. I'm going to give him some lisinopril, vancomycin, and insulin.
Okay, and what are these specific medications that the client's receiving?
Lisinopril, this is given because he has a history of hypertension. He's getting vancomycin because he has the right ulcer on his heel, and that is an antibiotic. And for insulin, he has elevated blood glucose, so we're giving him insulin.
Okay, and what action do these meds have on the body?
For lisinopril, it is an ACE inhibitor. It stops angiotensin 1 from turning into angiotensin 2, which is a vasoconstrictor. For vancomycin, that is an antibiotic that binds to the bacterial cell wall and destroys the bacteria. And for insulin, it slows down the liver production of glucose, and it helps the skeletal muscles to absorb the glucose already in the bloodstream.
Alright, and when should you question administering these meds?
With lisinopril, that is for his hypertension. If he has a normal or low blood pressure, then we're not going to give him that medication. We want to avoid lowering it to dangerous levels. For vancomycin, we don't really have any sort of parameters as to withhold it unless he has a bad reaction to it. With the insulin, we're going to hold that if he has low or normal blood glucose because we do want to avoid hypoglycemia.
Okay, and then do these medications have therapeutic serum levels, and what are the vital signs that should be monitored?
The only one that has a therapeutic serum level is vancomycin, which is 20 to 40 micrograms per milliliter. And what was the other question?
What vital signs should be monitored?
We want to look for with the vancomycin. We want to make sure to keep an eye on his temperature. If it's elevated when he's getting the vancomycin, that could indicate a serious infection. And the other vital sign would just be for lisinopril, which would be his blood pressure.
Alright, which physiological parameters should you be monitoring when the medication is being administered?
We want to look for lisinopril. We want to look for hypotension and angioedema. Angioedema, we have swelling of the face. For hypotension, they're going to be dizzy when they get up. For vancomycin, we're looking for anaphylaxis, so that would be a rash anywhere on that patient's body. And then for insulin, we are looking for hypoglycemia, which could be any anxiety or tingling in the hands or the feet.
What interventions must be taught to the client to ensure the medication is administered safely at the hospital setting, and what interventions must be taught for taking the medication safely at home?
So for at home and at the hospital, for the insulin, we do want to go ahead and rotate the injection site. If we use the same injection site, that could be some malabsorption and some lipodystrophy there. For the vancomycin, he is getting that IV, so we're only going to go ahead and administer that at the hospital. We want to make sure that we keep everything clean and we don't have any infections running through the tubing itself. And for the lisinopril, we do want to check his blood pressure before we give it. And the same thing at home, he wants to check his blood pressure before he takes it as to avoid the hypotension.
Right. What are the side effects and potential adverse reactions of these meds?
The lisinopril, as I said, we have the hypotension and angioedema. For the vancomycin, we do have the anaphylaxis, and for the insulin, we do have the hypoglycemia.
Okay, and how will you know when the medications have been effective?
For the lisinopril, when his blood pressure is within normal parameters of his baseline, that's when we know it's effective. For the vancomycin, it's pretty much the absence of an infection. And for the insulin, when his blood glucose has returned to his baseline normality.
Okay, that's all I got for you.
All right, you want to watch me while I give these meds?
Of course.
All righty.
Thank you.
Hello, Mr. Levi. How are you doing today?
Oh, I'm good.
All right, I always want to wash my hands as soon as I get into the patient's room. And I'm going to go ahead and do some teaching for Mr. Levi as well about his medications. Now, Mr. Levi, do we have any questions? Do you know any side effects of the medications that you're taking today? Your vancomycin, insulin, or the lisinopril?
I think I used to.
All right, so I'll go ahead and go over some of them. Vancomycin, the main thing we want to look out for is any allergic reaction. If you get any rashes or anything like that, you need to call the doctor and let him know. I'm going to go ahead and give you these reading materials as I go through them. The insulin, we do want to watch out for hypoglycemia. This can be in the form of anxiety, if you have tingling in the hands or the feet. We do want to keep an eye out on that. And the lisinopril, we want to watch out for angioedema, which is a life-threatening condition. The sign of that is swelling in the face. We also want to watch out for hypertension, so make sure that your blood pressure does not dip too low. All right, and I am going to quiz you on these, so go ahead and take your time to read through those.
Okay.
All right. So the first thing I want to go ahead and give Mr. Levi here is his lisinopril tablet. Now I'm going to go ahead and check out his name. Mr. Levi, can I go ahead and get your name and date of birth, please?
Yes, Levi. Restivo. I'm 67 years old.
And what sort of allergies do you have?
I will tell you once the lights come on. I'm scared of the dark.
Okay.
Tetracycline, dog hair, and peanuts.
All right, just like it says on the name bands there. All right, and I'm going to go ahead and compare that to my chart. We do have Mr. Levi Restivo, age 67, and we're going to go ahead and check the drug allergies, which is tetracycline, food allergies, which is the peanuts, and the environmental allergies, which is should be the dog hair. Yes, excellent. All right, so first thing I'm going to go ahead and do, I'm going to go ahead and check out the physician orders here and make sure his lisinopril is, in fact, on here. Okay, so we do have lisinopril 10 milligrams by mouth daily. I'm going to go ahead and compare what I have drawn up here, make sure we have this. Check this when we draw it up and right before we administer to the patient. So we do have lisinopril. We're checking that expiration date. It's 8/2018. That's good. And it is a 10 milligram tablet that we have here. So it matches the physician order. And I'm going to go ahead and compare that to the MAR. All right, so we do have the lisinopril tablet here at 10 milligrams oral once at 1700, and it is 1700 now, so we can go ahead and give him that is the correct route dose time. And before I give this, I'm going to do two things. I'm going to go ahead and check out what we have for his blood pressure. So we do have his blood pressure at 132/70, so that systolic is a little bit elevated there, so we will go ahead and give him this lisinopril. And another thing I'm going to go ahead and do, always check with the pharmacy to make sure if this is supposed to be given whole, crushed, cut, anything like that. And I checked with them and they did say it's supposed to be given whole, so that's good. So going back to the MAR here. The lisinopril. And I'm going to go ahead and check with the... All right, so it looks like we have 6867, 645, 607. All right. right, so we do have Levi Restivo here. And I'm going to go ahead and take the lisinopril tablet that we have confirmed here and put it in. All right, so we do have the green verified button there. And I'm going to go ahead and put on some gloves before I give any sort of medication to Mr. Restivo, as to avoid any cross-contamination from other patients or the hospital. Alright, so we do want to go ahead and give this with water. Now, Mr. Restivo, do you have any problems swallowing this pill?
No.
Alrighty, you always want to make sure they do not have any sort of dysphagia here. I'll go ahead and put it in here. Give him a cup of water. Here you go, Mr. Restivo. Go ahead and take that.
Gulp.
Alright, so we did go ahead and give this at 1700. And we're going to go ahead and do some comments here. And I'm going to go ahead and include the BP, just so that we have a quick reference here. Alright, and that is given. Next up, we're going to go ahead and move on to the insulin. Now, one thing to check before that, I'm going to go ahead and check his blood glucose and then compare that to the physician orders and the MAR. Alright, so we do have 290 blood glucose here. And it is 1700. The meals here do come around 1730. So this is a good time to give the regular insulin as well. So 290, I'm going to go ahead and compare that to the provider orders. All right, and as we see here, we do have a sliding scale with a blood glucose of 290. It falls between that 241 and 300, which is the 16 units of regular insulin. Now I'm going to go ahead and compare that to the MAR. Alright, so we do have the regular insulin here. I'm going to go ahead and plug in the patient information as well as this barcode here to make sure he can go ahead and receive this. Alright, so we do have verified here the regular insulin, and I did check the expiration date is 07/2020, and we are giving regular insulin 16 units subcutaneously here. Alright, so now that we have the green light, I'm going to go ahead and draw this up. Alright, so I am going to go ahead and use an alcohol swab on top of this. And I'm going to go ahead and inject 16 units of air into this.
Okay, so Maria, over here, we want to go and make sure the insulin is not expired, see provider orders, make sure that we have all medications.
Alright, and I am going to go ahead and recap using the one-hand scoop method here. And student nurse, can you go ahead and verify that this is indeed 16 units of insulin?
It is.
Thank you very much. Now we did see that he has received an abdomen injection before, but where I'm going to go ahead and do it, I'm going to go ahead and use the right upper quadrant for this.
Also for the weeks also the wound care, we're gonna clean the wound later, and then we're gonna consult on the
Alright, so before we stick any patients with a needle, we do have to use
over here
an alcohol pad.
and check the vital signs. So these vital signs.
And we go ahead and go right in.
32 over 70.
Inject, hold for a second. Alright. And we do not recap this needle, this goes straight into the sharp container. And now I'm going to go ahead and document what we have here. So we have given this at 1700. And we gave 16 units to the right upper quadrant. And we're going to go ahead and write the blood glucose, which was 290. Okay, so we have the administration time. We have the green light. The administration time is 1700. We gave 6 units to the right upper quadrant. Subcutaneously, we have the blood glucose there at 290, and we have the initials, and I'm just going to go ahead and save. And that has been administered. Now I will go ahead and move on to the vancomycin. I'm going to go ahead and clean up just a little bit here. Alright, so we will go ahead and confirm this with the doctor's orders. So we are going to go ahead and we're going to go use normal saline for this vancomycin infusion. And we have that here, the sodium chloride normal saline. We have that at 30 milliliters per hour continuous. Now, I do not remember seeing that on the orders, but we can go ahead and check that.
And otherwise, I would have to contact pharmacy and make sure that if I need to crush the pill, if he has any issues following, so he's good.
Alright, so we do have the vancomycin on there, but we do not have any orders for normal saline, so I will go ahead and give the doctor a call. Hi, this is Chris from level 4. Yep, the normal saline, yep. Okay, you got it, alright. Alright, so the doctor did say to go ahead and give that. He's going to go ahead and put the orders in. So we have the order from the doctor, and now we're going to go ahead and go back to our MAR. And go into the normal saline. Now, we went ahead and checked with the pharmacy to make sure that all of these medications are within a safe dose range route, just to make sure that we do not have any contraindications or adverse effects with Mr. Acevo here. So now we are going to go ahead. So we do have the sodium chloride here. It is not expired. We have the 500 milliliters and it is a normal saline, 0.9%, which does match with the MAR. Okay, so we do have the green verified light, so we can go ahead and safely give this to Mr. Acevo here. Alright, so while we're going to go ahead and place this up onto the bowl, we do have the Alaflow here. What I'm going to go and do is I will go ahead and spike this bag first. Alright, so this is a new spike. Make sure this does remain sterile while doing this. And we make sure this is clamped off before spiking it to make sure. that we are not getting a cool day. Alright, so now I'm going to go ahead and connect my dialiflow to the primary line. I'm going to go ahead and prime them both at the same time here. Alright, so this is the dialiflow. I'm going to go ahead and scrub this part here with an alcohol pad. Okay, and right now this is in the off position. So now that I have everything hooked up, I'm going to go ahead and prime both of these at the same time here. Make sure we don't have any kinks or anything in the line, and I'm going to go ahead now. Open this up. Make sure we get everything, all the air out of the line. And it looks like we have everything out. So now we go ahead and turn that off. Now I'm going to go ahead and give Mr. Steve-O's IV line a flush here. Now I'm going to go ahead and take a look at this, make sure it looks dry and intact. Now I'm going to go ahead and give this a good cleaning with the alcohol swab here. And what I'm going to go ahead and do is I'm going to go ahead and push, make sure there's no type of occlusion here. If I find any resistance, that could be a blockage. I'm going to go ahead and pull back for some blood. If you see the blood, continue to push. All right, this line is good.
We don't have, so we're good to pump with us right now, so we're going to
And I am going to go ahead and give this one more cleaning. Before I connect these two lines. Clean. Connect. Alright, now that this is connected, I'm going to go ahead and clean up slightly here. Alright, so now that we have everything set up, we do have that verified, so I'm going to go ahead and start this infusion at the orders of 30 milliliters per hour. Alright, so make sure that everything is unclamped, and I'm going to go ahead and set the dialiflow to 30. Now with this, we do want to go ahead and make sure that we do have a 5 drops. Make sure that everything is good there.
So, in this comment section, we are going to record where we administer the site, so next nurse knows.
3,
So administer times 17 times.
4, 5. All right. So now that we have everything running on Mr. Restivo for the normal saline, so we do have the site at the right forearm here. The right forearm. And it is 1700. In comments, I'm going to go ahead and put down there that it is 30 milliliters per hour. IV in the right forearm. And since this is already going, we can go ahead and save this. We have initialed time Pharm 30 milliliters per hour IV in the right forearm. So that is now administered successfully. Now the very last thing that we have to go ahead and give Mr. Estivo here is his actual vancomycin. Once again, we're going to go ahead and check out the orders. Alright, so we do have vancomycin 1.5 grams IV. That's exactly what I have pulled up here, the vancomycin. The expiration date is 8/20/18. We have the 1,500 milligrams at 250 milliliters per hour with normal saline. And now that we verified that with the provider orders, we're going to go ahead and check that one more time with the MAR, and then we are able to administer vancomycin injection. And we have the patient ID. And we're going to go ahead and get the green light here. All right, so we have the green light here. We have verified that. All right, so we're going to go ahead and make sure this is all the same here. So we do have the vancomycin at 1,500. It is given over 2 hours with that normal saline. So since it is the 250 milliliters over 2 hours, we're going to go ahead and put this at a rate of 125 milliliters per hour. Now this is through the IV piggyback, and this is given once at the 1,700. So we have verified the correct dose, route, time, patient, etc. So we do have the green light for the verified, so now I can go ahead and give this. All right. Just cleaning up a little bit. Alright, so since we are hanging a secondary line, we are going to go ahead and move this one down. And while we are doing this, we're going to go ahead and stop the infusion for now, as we are going to go ahead and change the rate later on for the Vanco. Alright, so. Again, this is a new spike, sterile, keep it sterile. We have that, and we do have it clamped. Alright, and I am going to go ahead and prime it and avoid wasting much of it. Alright, and we are going to check the line here to see if there are any bubbles, and it looks like we are good to go. So we're going to go ahead and now connect this to primary line here. We're going to always scrub the hub here. That is clean. Alright, that is good. Now we can go ahead and unclamp this here. Now just because we have unclamped that does not mean that this is going just yet. We do have to set the dial flow here. And this is 250 over 2 hours, so I'm going to go ahead and set this to 125 an hour here. And we're going to go ahead and make sure this is flowing, make sure everything is unclamped. Okay, good. And now we wait for the 5 drops here. Alright, so we have the 5 drops there. So now that we have this going, we can go ahead and do our charting. So this is supposed to get 1700. And any comments? This is just given the IV piggyback. We do have the right forearm IV, and I can go ahead and initial that there. We have the 1700 right forearm IV. We have verified this, initialed, and then I can go ahead. We do have the 125 milliliters an hour. I'm gonna go ahead. I'm just gonna go ahead and save that. We have the orders. Okay. So we have gone through. We have given the insulin, the regular insulin. We have given the vancomycin, the lisinopril tablet, and the sodium chloride. All right. So that is all of your medications here, Mr. Recibo. Now, as I said, I'm going to go ahead and quiz you on this. First off, I am going to go ahead and wash my hands, though, so I do not forget that before I leave the room. Alrighty, Mr. Recibo. Now, what sort of side effects can you or are you looking for with your lisinopril?
Lisinopril, I'm looking for hypertension, so I need to check my blood pressure. And then also angioedema, which is the swelling of the mouth.
Very good, very good. And for the insulin, what do you need to look out for?
Sweaty, lightheadedness, anything that could indicate hypoglycemia
Good.
or allergic reaction.
Good. And the vancomycin, what can you look out for on the vancomycin?
Rashes, developing any type of allergic reaction or hearing loss.
All right, very good, Mr. Recibo. Very good, very good. All right, Mr. Recibo. So now you have all your medications. I'm going to go ahead and leave with my student nurse, Travis, here. I'm going to go ahead and wash my hands. Now, Travis, do you have any questions for me?
I do. Were there any pertinent pieces of information you reviewed before administering the client's medications?
The things that we do look out for, we do check the blood pressure for the lisinopril. We check the blood glucose for the insulin, and we just go ahead and give the vancomycin if there's no contraindications for that.
Okay, did this information affect your decision to administer the meds?
Yes, we do have a sliding scale put in place for the insulin, so we go ahead and follow the procedures for that. And we check out the blood pressure, make sure it's not too low for the lisinopril.
Okay, did this information affect how you administer the medication?
We administer it all the same. Like I said, we do have a sliding scale put in place for the insulin. Everything he's able to swallow, so the lisinopril in that tablet form is okay for him, and the vancomycin, we don't have any contraindications, so that was a good one for him as well.
All right, well, thank you for your time.
Absolutely.